If I said that 2020 has been a difficult year for the entire humanity, I don't think it would be an exaggeration. We are still in the middle of it. It's too early perhaps to draw definitive conclusions, but there are definitely some approaches that are working, some things we could have done better. And this is time to now begin to reflect and really work towards building back better.
We must forge a global dialogue and chart directions for a resilient future for humanity at large. This would be the most worthy tribute to our people, particularly health workers, emergency responders, frontline workers, who have put the world's safety before their own personal safety. The key lesson from the pandemic is that the principles of resilience must be integral to our quest for economic growth as individual nations and the international community. We need to pursue disaster resilience as an essential area of common interest globally. Our lives and livelihoods may very well depend on it.
Private sector needs to be engaged in the development and implementation of disaster risk reduction and resilience strategies. Knowledge and capacity of frontline workers and health responders on prevention needs to be built.
No one is safe until everyone is safe, and exclusion is more costly in the long run. We must build a resilient health system to advance universal health coverage and health security to protect health infrastructure and supply chain.
I would like to mention that Sri Lanka is a country with a resilient health system which has delivered excellent health indicators in a cost-effective manner.
So we are talking about a role model public-private sector partnership here, where there is a win-win situation and we have a country where mortality rate is almost less than 0.3%. So this is a very good example of private-public partnership in building resilience in healthcare infrastructure and facilities.
We have three basic strategies. One is recovery, output, and growth. The second one, strengthening resilience, reducing vulnerabilities. And the last one is strengthening public finances and ensuring service delivery.
We have to make sure that through simulations, we have an understanding, what do we want? And then make decisions, which might be political, how we can cover that. With the cost of infrastructure, it is infrastructure, that's what we are talking about. And then find out what we want to do and what we are able to afford.
Although we talk about the healthcare system, but it's still very much the cure part. Like when you have already got some disease, but how we can have some more preventive care system. I think that's a very, very important system, and how we can make that whole healthcare system is a more care-oriented, not just cure-oriented.
If you had to had the opportunity to meet the highest level government functionary in your country for 1 minute, and you could ask for anything in terms of a policy enabling environment for private sector to play an effective role in managing a health emergency of the kind we are witnessing right now, what would you ask?
It is very important that we are in a collaborative model. We are not in competitive model. And in healthcare industry, governments all over the world have realized that they cannot alone do it. It has to be in partnership with private sector.
We need unified information, and unified information means as well information that is actual, that is coming from one source, that is not distracting, but which is pretty much forward and offer you a very frank view on the situation.
This webinar is a milestone not just towards ICDRI 2021, but both UNDRR and CDRI will be working together in this space. So this is not just webinar, we will also be pursuing some concrete action with in support of our partner countries, with our delivery and knowledge partners.